A very good morning. How are you doing? Welcome to Nuru Ya Asubu. We're here for Family and Health Thursday, and you're glad that you are able to join us this beautiful morning. We have with us in studio Dr. Steven Musyoka, who will be helping us understand more on this. And so he is a doctor and also the director of Clear Scan Medical Solutions. So are you there? You need some ultrasound, general medical checkups, general medical treatment. That is the place for you at Lydia Arcade. Atatuambia pia room ni gani na pia utaweza kujua how you can connect with him. And so today's topic, it's something that you need to be on the lookout for because it's TB. And bado iko actually, and still there are people. I remember like a month ago I got to lay someone to rest due to the same tuberculosis. So I want us to discuss that topic of today. And if you have any questions concerning that, remember to tag us on to comment via the SMS line and also via Facebook and also YouTube, our channels. That is Mizpah TV Kenya. Karibuni tuweze kusemezana. Good morning, Daktari.
Good morning to you, Emily.
How are you doing?
I'm doing fine.
Lydia Arcade ni room number?
105.
105.
Yes.
Thank you so much. Karibu sana.
Asante sana.
We are glad to have you today.
I'm happy.
And I know today's discussion is going to help also enlighten the people in a big way.
Sure.
So karibu sana. TB.
Yes.
What is it? And tell us more.
Thank you very much
Yes.
for having me and always having the people at heart in matters of helping the society.
Yes.
And sorry for the loss. You've talked about to lose somebody due to TB just a while ago. Yes. It's important that you've said it's still there and it's still a problem. Just to bring us to speed before even I say what TB is that TB is rampant. It's something that is affecting the country. The latest statistics states that we are having 120,000 people suffering TB every year.
120 people.
120,000 people getting infected with the TB every year, and among those 120,000 people, 18,600 people are dying from TB. So if you realize that it's not a rare thing. I know from the statistics, from research, tuberculosis is one of the oldest diseases that has ever been there, and we have not been able to eliminate it, not just as a country but also as a world. It's a worldwide disease, an ancient disease that has been there. Efforts have been there to try and mitigate the effects and even try to close that gap and reduce that mortality and morbidity. Luckily enough, we thank the government and the partners. They're doing good. Currently, there is a plan and there is a vision in regards to TB treatment to reduce the mortality or the deaths by TB by about 90% by the year 2030, and to reduce the new infections or the new people who are getting newly diagnosed or getting newly infected with TB by 80%, that is by 2030. And these are some of the things that I said it's good because it's helping the society. So you are helping the government and the partners to try and bring out the information and try to help people in trying to achieve that target. Now, back to the other question.
Yes.
Now we know how big the problem is.
And actually it seems so active even now. So we should not assume.
Exactly.
Okay.
Yeah. Now, what TB is? TB is a bacterial infection that usually affects the lungs.
Okay.
But not only the lungs, because we have two types of TB, what we call pulmonary TB. That one is just localized within the lungs. Then we have what we call extrapulmonary TB. Okay. That means that it's TB that can affecting any other part of the body. And I remember when I was school, when doing my basics, I was told TB can affect any part of the body except the nails and the hair. Yeah, so we have the pulmonary TB, what most people know. And then we have the extrapulmonary TB, what most people don't know. And you can end up with a problem without noticing that you have that kind of TB. So I've said it's a bacterial infection caused by what you call Mycobacterium tuberculosis. Yes. So the tuberculosis now name comes from the bacteria that causes the causes the TB. Yes. So so most of the times they will present with now respiratory symptoms or symptoms ambazo zinahusiana na the airway. Yeah. So that is why most people will be lack or might not notice they have an extrapulmonary TB. But I'm going to just mention a few things about the extrapulmonary that people need to be on the lookout for. But for the pulmonary TB, which is the most common and which is mostly most infective, that's the other thing why the pulmonary one is more talked about than the extrapulmonary, is because of the ease of transmission of the pulmonary TB. Yes. So now, when you get this kind of bacteria, which can be gotten very easily, and that is where the key thing first comes in. How do you get TB? Because that is now what we're going to inform us. How do you prevent the TB? Because we don't want even to treat. We want to see if we can prevent it even before we get it, because treatment is another thing altogether. Yes. So it's being a respiratory disease. It's usually transmitted through air. Okay. Yeah. So that means that we've come close to very close to a person who has active TB, or you inhale any air that is contaminated with the mycobacterium. That means you must not come to very close contact with this person. You can get into a room which is not well ventilated, and there's somebody there who has TB. So when they cough into the air, they don't practice cough etiquette, those bacteria can remain suspended in the air. And when you come in, or anybody is in that room, or they come in, they can be able to inhale those bacterium, and then now they get to get the TB. Okay. So practicing etiquette or cough etiquette is one of the key things that is going to help us prevent this spread of this Mycobacterium tuberculosis. Hygiene. Hand hygiene, what we did when we were having corona. You remember the corona time? So the same thing. So if we practice that, if we don't just wait for another corona to come so that we can start washing our hands, then we are doing. Remember, most of the time you cough, you use your hands to cover your mouth, and then you go greeting everybody. That person you greet, they will get their hands again to their mouth and their nose. You see, that's how basically these respiratory diseases, including TB, they usually spread. Yes. Yeah. So it's important for people to know that you need to practice hand hygiene and practice cough etiquette. They are very important in trying to prevent the spread of TB. Then again, now when it comes to the areas we are living in, the rooms, the houses we are living in, don't just have the windows closed all the time. The same thing that gets when you get to a matatu. I see, especially now when the weather is chilly, you get to a matatu and you want to lock all the windows. You don't want any air kidogo in here. Then you start seeing that film forming on the windows. So what does that mean? You are breathing your air out. Everybody bring their hair there, then you breathe it in. So you are recirculating the same hair that you're. So those are some of the challenges that we have, and but we can do something about it. Okay. Make sure that you are well ventilated house. When you get to your vehicle, make sure that it's well ventilated. Practice hand hygiene. Practice cough etiquette. Okay. Yeah.
So because it's airborne, and you get to find out, you might be going to a place, then you find maybe you might not even know that person has TB, or they themselves they don't know how that they have TB. So what are some of those signs that can show that unaangalia huyo mtu na pia wewe mwenyewe ukijiangalia?
Yes, the symptoms of tuberculosis are very important. By signs, by looking, it may be a bit trickier. I want to emphasize, I will tell the signs, but I want to emphasize more the symptoms that somebody experiences, because it is more of you even before you think about the other person. And the number one thing is cough. Initially, when we were in school, when we were in our basics, those many years back, we were being told cough that is been there for more than 2 weeks. Nowadays, that things have changed. We are saying cough of any duration. That is number one. Number two thing that these people who have TB tend to have is what we call their fever. You might have low-grade fever throughout this time. There is another key thing that usually presents with TB presents with what we call drenching night sweats. Drenching night sweats. That means that umelala, umeamka vizuri, then when you wake up, you find that your bed is wet. Your beddings are wet from sweating. then you're like, oh, yeah, it's not that thing. Yeah. Then you realize the following day, they say the other day you're still having drenching nitrates. Okay. That is another very key thing about TB. Then the other key thing would be that now the nausea and anorexia, or feeling you don't want to eat. Yeah, unakosa tu appetite, unakuwa tu uko tu. The other thing that you present, or the other symptom of TB is weight loss. Yeah. So if you realize that now you're losing weight, and it's not intentional. You know, nowadays we are letting people getting fit and keeping fit. So we are encouraging people to keep fit so that we can prevent non-communicable diseases. So if you have lost weight, you are losing weight very fast, and it's not because you are dieting or you are exercising, then that is another thing. So all those things are key things that you need to look at. If you have any of those symptoms, then it's important to make sure that you are checked to confirm that you don't have TB.
So you've said cough?
Cough of any duration.
Any duration?
Yes.
Okay.
Yes. Then you accompanied fever.
Okay.
Then you have weight loss. Then you have drenching nitrates. Then you will have lack of appetite. Those 5 things are very key.
Those are the symptoms.
Those are the symptoms. That is what we expect to see. So, of course, when you come to the doctor, we will ask you those questions. Then now we'll look at the signs. So, no, the signs is what you see with your eyes. Okay. So then we look at you and you're like, hey, this person looks emaciated. They look poorly, to have poor nutrition. Then now we'll ask those questions. If you're not mentioned, then we'll ask you them. Then we'll combine now the signs and symptoms. Of course, when you go to examine, we'll examine you. Then we'll be able to pick a few things, and then we combine the two, and then we come up with a conclusion that this is likely to be tuberculosis. Then after now we have taken that history, we have examined you, then we think you have TB. Now the next thing is diagnosis, of course, and we thank God, the diagnostics are readily available, and anybody can get them, even in the public facilities. We have readily available diagnosis. So if you have those symptoms that I've just mentioned about, you just need to get to the nearest facility. They will just get your sputum. We usually talk about early morning sputum. Then they will do the microscopy and be able to tell if you have TB or not. Or if that does not happen, then you think about what we call gene experts, which is another very important tool, latest technology that we are using in diagnosing TB, which can also detect what we call MDR, multiple drug resistant tuberculosis, because now that is another thing that now we are talking about. Yeah, now we have moved from just talking about TB as TB. We are talking about TB and the multiple drug resistant TB or MDR TB, which is again is a very big problem that we are facing. So that's why I told you we need to prevent even getting there, because you can get there, then you get to the MDR TB, which is a bit complicated, very expensive to treat. Not because the other TB is cheap to treat, it's very expensive to treat, very expensive. But because the government provides for us, we usually tend to think, nitaenda tu hospitali na nitapewa dawa. But we thank God, because now the treatment is available. And nobody should be left to die of TB. Nobody should be left without treatment just because they have TB. Because the treatment, the diagnosis are available, the treatment is available, and that's what the government has been saying. And there's a campaign going on currently about the need to go and get screened and get treated, because when you treat somebody, you prevent another person from getting TB from this other person who had TB. So basically, everybody, we usually say most of us have been exposed to tuberculosis. When you get exposed to tuberculosis, it's important for us to know that it's not a must that you get the disease. Most people get exposed to the tuberculosis bacteria because of your good immunity and the vaccination that you got when you are young. Everybody has yes, that one there, that was given to your body to prime it, so that now it is aware and it prepares the immunity that in case you come across the Mycobacterium tuberculosis, then your body is able to fight. And luckily for most of us, yes, we are able to fight and contain it. But that does not mean that it's completely gone. You get what we call latent. It's just there, it's just dormant. So most of us have it, but it's dormant. It does not affect you. And it's important that I mention here that that latent TB that almost everybody has come in contact with, or everybody has, is it can be reactivated. Right? Inaweza amuka. And what makes it reactivated basically is related to the immunity.
Okay.
So anything that is going to lower your body's immunity, then you're giving the latent TB a chance to get reactivated. And I think it's important that I mention here that you know, those hot days, everybody who got TB, and even now there still have some myths about it. Everybody who has TB has reduced immunity, and reduced immunity, what we know is most cause of reduced immunity is HIV, right?
Yes.
Yeah, so it is true. Most of the patients who have, or most of the clients who have had HIV and they have not on treatment for the same, the immunity will go down. Now, when the immunity goes down, then the TB that was dormant in their body or the latent in their body gets reactivated, right? So it is not a must that because you have TB, you have HIV, and it's because you have HIV, you must have TB. That stigma is not good, and it's one of the things that we are fighting completely, because because everybody does this, kona TB, we lazima kona HIV. That stigma is what we need to fight and break it completely, because it's going to make people get shy to seek treatment, because you're like, nitaenda hapo niambiwe niko na HIV. Even some of them just stay and they're like, hey, yoko nimekoa wiki mbili, hiyo ni TB, na kama niko na TB niko na, so they don't go to hospital. So by the time they're getting to hospital, it's too late. So that stigma, you need to carry it completely. It's not a must, but it's true that if your immunity is reduced, you can easily get a reactivation of the TB that is within the body. Then you now get full-blown disease of tuberculosis. The other things that usually cause immunity to go low, most common things, there are so many things, but the most common is usually the HIV, diabetes, because again, if you have diabetes, your immunity is low. That's why we need to control it very well so that we don't have the effect on the immunity. There are some people who can be given some drugs, we call them steroids, and most people are getting over the counter these drugs, and it's not good. The steroids, if you use them for a long time, they can suppress your immunity again. That can also give the latent TB a chance to get reactivated and suffer from the tuberculosis. Yes.
Okay. So we need to check on our immunity very much. Because if everyone has the scar and everyone has been immunized, but if you are low, you have a higher chance of getting it.
Yeah, if your immunity goes low, you have a chance of getting the TB.
And how can we boost our immunity? Is there a way we can boost it to make sure we don't lower it, apart from the diseases we need to check on?
Yeah, basically we talk about good nutrition.
Good nutrition.
You do good nutrition, your immunity will be good, and exercise. You exercise, you do good nutrition, balanced diet. I know everybody knows what is balanced diet. That's been taught in primary school, in high school, and even if you don't go to school, even our shushus and our grandparents, they used to know what to give the child, what you need to eat, the food, kind of foods you need to eat. Sorry, basically the fruits. Vegetables, they give you the vitamins that are able to boost your immunity. So it's just balanced diet, and you're good.
And you're good to go.
Yes.
Okay. And so you mentioned a bit about the signs. We insisted on the symptoms, but the signs, would you also repeat that so that people can understand?
The sign that most people notice on a person who has TB is weight loss.
Weight loss. That is the number one sign.
That is what they will see. That's what you're likely to see in most of the people. Okay. That is for a general person who is, or a general public. We're looking at somebody like, na umepoteza kilo. Yeah, that is one of the things.
Okay.
Yeah.
So if you see that, then unaona anakohoa.
Unaona anapoteza kilo, anakohoa, muulize, umepimwa, not HIV, umepimwa TB. Yeah, we don't want the stigma. I must insist on that. We don't want the stigma related to TB, so that we can reach as many people as possible and treat them and make sure that they don't get the disease. Okay. Yes.
Wow, I think this is so interesting and people need to know. So ukiwa hapo na you have somebody na umeona those signs that the doctor madaktari mentioned, please make sure you insist to them. And kuna wenye wanaweza shanga, wanaweza kuwa wakiogopa wakiambiwa waende screening. Kuna watu najua hata hapa kuna watu wanaogopa sindano na nini. So what ukiambia mtu aenda screening, ni nini anafaa kuexpect? Which I think you mentioned.
That now the investigations. How do we investigate? The question is, how do we investigate TB, or how do we make sure that someone doesn't have TB or they have TB? As I said, that basically huwa tunapima kikozi. That's number one thing. Okay. You just get the sputum and utaambiwa, utaenda, if you go today, you'll be told you leave the first sample, then you bring another one very early in the morning before you take anything, because it's usually believed that the first sputum that you produce is highly concentrated. If it has bacteria, it will be more concentrated, so it will be easy to pick it. So you do the sputum, that is number one. Number two, I've said that you can do radiograph or x-rays. Let me x-rays. Most people call them x-rays. They are called radiographs.
Yeah.
So you go, if you suspect you have it, you can be sent for an x-ray. So ukipigwa hiyo picha, then you'll be able to see the changes that kuna vile huwa we see the cavities, if it's a miliary TB, we see the miliary picture of it. Then the doctor will be able to interpret that this is likely to be TB. There are also other blood works, ama vipimo za damu ambazo tunafanya. So kipimo damu, we look at the ESR, we look at the ESR. If the ESR is elevated, you have the symptoms. We combine all this one, then we come up with a conclusion that this is TB. So once you go kasindano ni kadogo kakutoa damu tu just in case. Yeah, for full hemogram and ESR.
Okay, yes. Wow, I think this is interesting. Allow us to take a very short break, but when we come back, now the preventive measures which he has talked of, but also the treatment that comes in with it, because kuna watu wengi sana wanaogopa madawa nini, tutaka kujua pia kama kuna alternative ya badala ya madawa ama sindano. Kuna kitu kingine imekuja? No, we take a break, we'll be back at once.